Professor Pashchenko method is used for the treatment and prevention of the most common diseases, such as hypertension, angina pectoris, chronic bronchitis, bronchial asthma, allergic diseases, diseases of the gastrointestinal tract, and genitourinary system. The method is based on increasing the partial pressure of carbon dioxide to normal levels in the alveoli of the lungs with constant procedures for eliminating deep breathing. As a result of increasing the carbon dioxide content in the human body, metabolism is normalized, damaged organs and tissues are restored. The process of restructuring the body occurs slowly. So the method is divided into stages. At the first stage, with pathology of the heart and blood vessels, pain in the heart area decreases over the course of several months, and the use of antihypertensive drugs decreases. A number of techniques are used to normalize carbon dioxide levels in the body. Among them, the simplest is to enhance the production of carbon dioxide by the body's cells through physical activity. This effect can also be achieved by inhaling an air mixture enriched with carbon dioxide or drinking water with a high content of carbon dioxide. Therapeutic fasting is used for a similar purpose. But the simplest method of combating carbon dioxide deficiency in the human body is shallow breathing, which has been used for thousands of years in Eastern medicine. The partial pressure of carbon dioxide in the alveoli of the lungs increases to the normal level within physiological limits by eliminating deep breathing as well as in the methods of Jacobson, Buteyko, Strelnikova, and Oriental relaxation techniques. But treatment by Professor Pashchenko method is based on the property of carbon dioxide to regulate metabolism and energy in cells through personalized progressive muscle relaxation, which reduces the depth of inspiration. Personification taking into account the patient's metabolism allows for long-term remissions. Mastering the first stage of the shallow breathing method is divided into procedures. The procedures are posted on the author's page in the video section from the first and above. Subscribers receive a message about the broadcast of the following procedures. You need to start mastering the method from the first procedure. These procedures differ in the algorithms for the growth of carbon dioxide in the alveoli of the lungs, which creates the opportunity to master the method when translating the procedures. It is better to repeat each procedure for 3 to 7 days while listening to the broadcast. During the procedures you can watch TV, read books, listen to music. As the respiratory center adapts, the unpleasant feeling of lack of air in patients disappears, and the accumulation of carbon dioxide within physiological limits becomes pleasant. The skeletal muscles relax, pain disappears, and blood pressure normalizes over time. Carbon dioxide has a pronounced vasodilator and bronchodilator effect, increases the tone of the veins, stimulates the biosynthesis of proteins and nucleic acids, increases the lifespan of biopolymers in the cell, reduces the need for food, has an antioxidant effect by inhibiting the Krebs cycle and reducing the need for oxygen in human cells. The participation of carbon dioxide in the reactions of carboxylation, cell division and wound healing has been discovered. Carbon dioxide regulates electrolyte balance, acid-base balance, capillary permeability, and reduces the excitability of nerve cells. The ability of carbon dioxide to excite the respiratory center, the nuclei of the vagus nerve, and slow down the activity of the heart has been noted. Mastering the method is divided into stages for the gradual restructuring of metabolism in the patient's body, with a gradual transition to a higher stage. Health returns and patients gradually stop taking medications. The healing process depends on the degree of damage to the body. Seriously ill patients are cured within several years of constant regular procedures. The procedures carried out in today's broadcasts of the first stage of eliminating deep breathing in most patients lead to an increase in the content of carbon dioxide in the alveoli of the lungs and, as a result, to the disappearance of pain in the heart area, and gradually normalize blood pressure. Usually, with regular procedures, the amount of medications used decreases after 2 to 3 months. With deep, noisy breathing, especially through the mouth, the content of carbon dioxide in the alveoli of the lungs decreases, and with superficial breathing, invisible to the eye and inaudible through the nose, increases to the normal level. Due to a decrease in carbon dioxide content in the body, deep noisy breathing causes pain in the heart area, headaches, and increased blood pressure. When deep breathing patients were asked to breathe more shallowly, attacks gradually abated or decreased as carbon dioxide levels rose to normal levels. If they returned to deep breathing, the attacks returned. With deep breathing, hyperventilation, The partial pressure of carbon dioxide in the alveolar air decreases. Due to the Verigo-Bohr effect, the delivery of oxygen to tissues by hemoglobin is disrupted. A paradoxical situation arises. The deeper a person breathes, the stronger the oxygen starvation and spasm of blood vessels, bronchi, and bile ducts occurs as a protective reaction to the loss of carbon dioxide. This is how the body tries to preserve its carbon dioxide, which is quickly removed during deep breathing. Deep breathing and the associated decrease in carbon dioxide content in the body are the cause of the most common diseases of civilization, including bronchial asthma, arterial hypertension, coronary heart disease, varicose veins, many diseases of the stomach, liver, pancreas, intestines, diabetes, allergies. That is, those diseases that are based on metabolic disorders. In the alveoli of the lungs, shallow breathing increases the percentage of carbon dioxide from 3% in patients to 6% in healthy people. Only a few patients can achieve. As a result of persistent work to eliminate deep breathing, an increase in carbon dioxide content to 7.8%, which is accompanied by the development of superstability. It should be emphasized that the increase in carbon dioxide content to the normal level occurs slowly and can last for a long period from several months to several years, since it requires a restructuring of metabolism in tissue cells. Elimination of deep breathing should be done gradually, and give time to your body to readjust, normalize metabolism, get rid of toxins. It is impossible to normalize the carbon dioxide content in the human body without changing the metabolic rate and restoring the damaged morphological structure. In today's series of broadcasts, shallow breathing procedures are carried out for patients with arterial hypertension and angina pectoris. During each broadcast, the patient must perform the procedure. Recommendations on the specifics of eliminating deep breathing are given in each broadcast of the procedure. The recommendations covered in the procedure can improve the general condition of patients, reducing the frequency of pain in the heart, reducing the frequency of headache, reducing medication intake. This effect occurs when the procedures are performed continuously over several months or even days. The broadcasts differ in the modes of increasing the partial pressure of carbon dioxide in the alveoli of the lungs to normal levels. It is better to repeat each procedure yourself several times a day. If patients notice objective improvement over the course of several months, they can contact Professor Pashchenko, Facebook, Instagram, Patreon, to carry out stronger procedures of the second and third stages of the deep breathing elimination method, which are aimed at the person's complete recovery. In cases where the patient notes an objective improvement in the condition, the following, more powerful, stages of the deep breathing elimination method can be discussed. To do this, you need to contact the author after mastering the first stage in cases where you see an objective improvement in your condition after mastering the procedures of the first stage. Only then can you move on to the next stage, the goal of which is complete recovery. Contact links on the author's page. The first three procedures are aimed at explaining to the patient the role of breathing in the regulation of metabolism in human cells, oxygen transport to tissues, vasodilator and bronchodilator effect. As a result of mastering the first procedures, the patient should avoid deep, noisy breaths during the entire time. It is important to pay attention to the pace of walking and avoid deep breathing during movement. Learn to control the pace and distance of walking while maintaining shallow breathing. Learn to stop when breathing deepens. This therapeutic walking is strictly personalized and is related to the intensity of metabolism. As metabolic reactions in cells are trained, the pace and duration of therapeutic walking increases depending on the preservation of shallow breathing. If during the day the patient breathes superficially, shallowly, maintains shallow, silent breathing while walking, his pain in the heart area decreases, and blood pressure begins to normalize. The method of shallow breathing for recovery must be used for many months and years. During this time, the human structure is restored. Metabolism and the functioning of the heart and blood vessels are normalized. Once you master the second and third stages of eliminating deep breathing, complete recovery is possible. These stages differ in the modes of accumulation of carbon dioxide in the alveoli of the lungs. The stages of Professor Pashchenko method differ significantly from the Eastern relaxation methods of normalizing breathing, the methods of Jacobson, K.P. Buteyko and Strelnikova. The goal of the three initial procedures of the first stage is to teach the patient to monitor the maintenance of shallow breathing throughout the day. When shallow breathing is maintained and breathing through the nose is avoided, the heart vessels are the first to react. Typically, patients who slow down their walking pace and avoid deep breathing notice a decrease in heart pain within a few days. If shallow breathing during the day leads to improvement, you can begin to master procedure 4. The broadcast of the following procedures will be posted on my YouTube page. Subscribers will receive a message. Each procedure takes from 1 day to several weeks to master, depending on the severity of the condition. The following procedures for the treatment of arterial hypertension and angina pectoris will outline regimens for increasing the carbon dioxide content in the alveoli of the lungs, which will allow improving the general condition of this group of patients within 2 to 3 months. By subscribing to my channel, you will receive messages about the broadcast time of the following procedures. You can ask questions in the comments and in the chat. In comments and in chat. It is also recommended to indicate the country in which the patient lives, since there are geographical features of the method. In the chat or in the comments, it is better to note the effectiveness of the method if the patient performs the procedures. This makes it easier for other patients to master the method and recommend procedures that take into account the patient's complaints in future broadcasts.